throughout the talk, I have a bunch of different resources that I'll be talking about. And I'll have at the end a page if you want to screenshot it or take a picture with your phone for a lot of really important resources. So and see, there's some of the references that I use throughout the talk. And I just want to make a point that a lot of these symptoms or side effects may not resolve, but we're looking about how can we make them better or more manageable for our patients and for ourselves. So a lot of this is really finding your new normal and finding ways to make things better and manageable. So I just want to briefly just touch on what integrative oncology is, because that's a newer thing or terminology that not everyone may be familiar with. And this is just the definition from Oxford University Press. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions, such as traditional Chinese medicine, Ayurvedic medicine, alongside conventional cancer treatments, which is our world, or Western medicine, or where I work. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So for this talk, as I mentioned before, I'll be really focusing on blending both the conventional treatment or recommendations along with integrative or complementary strategies. So these are some of the topics I'll be addressing tonight, and it's a lot to go through in 45 minutes, and I'll do my best to get through as much of it as possible. But really looking at all of these things, there's certainly not everything that's listed here, but if you look at all of these different side effects or symptoms that come from or can be caused by cancer therapy, what is the one thing that improves, prevents, or has a positive impact on all of these things? There probably really is two things that have a significant impact, but I would really say that there was one most important thing where most of the research lies. And if everyone kind of has a thought in their head of what that is, the answer is exercise and physical activity. So there's significant amount of research showing that exercise is proven to have a positive effect on cancer therapy side effects, and I'll go into a little bit more detail throughout the talk. Exercise, it's also important to note, also improves immune function and lowers insulin levels or insulin-like growth factor, which are associated with cellular mutations and proliferation of cancer cells. So it's a really important part of cancer prevention and reducing recurrence risk as well. So if we start off with peripheral neuropathy as our first symptom. So this is the damage to peripheral nerves causing numbness, tingling, burning in the fingers and toes. Sometimes it can even go up the entire leg. The symptoms can worsen up to a couple of months after therapy. And I always tell my patients, not when cancer or chemotherapy is done, it doesn't mean everything starts getting better the next day. This is something that really can heighten, worsen to a couple of months after the last chemotherapy. And so it's really important to communicate with your provider as you're going through treatment to make sure that you're having that ongoing discussion if symptoms are increasing during that time frame. It can be temporary or permanent. We certainly try to mitigate it as much as possible with like taxane type chemotherapy. We can use cold therapy gloves and mittens and socks during the infusion to prevent neuropathy. There was a study that came out recently showing that women who had a higher level or a good level of vitamin D prior to receiving taxane therapy overall had less peripheral neuropathy development. So there's a lot of things we don't maybe always necessarily know in terms of mitigating or reducing it. And sometimes people are just left with peripheral neuropathy at the end, and it's a difficult thing to treat. So unfortunately, a lot of the oral prescription medications don't actually help the root cause of neuropathy. So these drugs listed here, gabapentin, Lyrica, Cymbalta, are all drugs that can be helpful in terms of reducing the symptoms of pain, but not improving the actual numbness that people feel. Acupuncture can be very helpful. This is one of those things that the evidence isn't particularly strong that it helps neuropathy, but I've had a lot of patients that have gone through acupuncture during treatment and after who've had really significant results and improvement in the neuropathy. And again, doesn't make it go away, but it improves it. So it's definitely something that's not harmful. And I would recommend everyone to do if you're dealing with any kind of neuropathy. It's worth trying. Occupational and physical therapy is important because they can help you to learn how to prevent falls or learn how to adjust activities and exercise in terms of the pain that you're experiencing. cancer rehab physician or provider. I put this on here because we actually have Dr. Philip Chang, who's a cancer rehab doctor from Cedars-Sinai that comes in weekly to our office to help with different types of side effects from cancer therapy. And he's really great because he can kind of, again, think outside the box and do things that maybe aren't necessarily mainstream, but really helpful for managing certain side effects, one of them being peripheral neuropathy. So if you're not a patient at Cedars or here, I would encourage you to look at your own cancer center to see if you have a cancer rehab physician. So exercise, staying active, so important. And again, this is a theme you'll see throughout, but specifically things like dancing, yoga, and Tai Chi. Those things really tap into our motor neuron skills. And there's been research showing the significant improvement in neuropathy in people who do those types of activities. So I would encourage everyone not to just exercise, but also to find something that taps into those motor neuron skills where you're thinking, processing while you're physically doing something, because that can tap into something and be even more helpful. There's different topical ointments that you can get over the counter. So Vicks Vapor Rub's been around for a long time and people have tried and it's helped with that. Conquer Cream is a newer one. Capsaicin cream. All these, again, you can find on Amazon over the counter. Topical CBD, it doesn't help everybody, but it's certainly worth a trial. So cannabidiol from the medical marijuana plant. So just CBD, typically with menthol added in it, I think is the better combination in terms of helping neuropathy. So if you're looking to try that, getting that menthol flavor or smell is probably a little bit more helpful. Cedar, I wanted to mention at Cedars, they do a topical capsaicin therapy, which is a new thing and it's not mainstream everywhere, but it could be something that's adapted more. So it's worth looking in your area. But this is actually something that's delivered from a provider and they apply lidocaine ointment to your feet to numb it before they put this high dose intensive capsaicin therapy on, which is, for those of you who don't know, it's the extract from a chili pepper. So it's very hot and spicy. And that's shown to be helpful for neuropathy. So supplementation. So B vitamins we know are really important for the synthesis of neurotransmitters and nerve health. So taking a B complex can be helpful, or specifically even B12, and possibly even if you're deficient, it's worth having your B12 level checked by your provider if you haven't already. Alpha lipoic acid is an antioxidant that has an effect on the oxidative stress mechanism along with peripheral neuropathy, and that can be helpful for some as well. That's one of those supplements you want to use with caution if you're on diabetic or thyroid medication, but again, something that you can consider taking. And omega-3 has some research behind it in terms of taking an omega-3 supplement to help with neuropathy. So again, something that can be safe to consider taking. Omega-3 does cause blood thinning, usually in 1,000 to 2,000 milligrams a day, shouldn't have any impact on blood thinning. So for those who have any blood thinning issues, chronic low platelet count, be caution with higher doses of omega-3. And the last thing I put on here was cannabis, specifically in THC or a combination of THC CBD. This is not something that's been clinically proven. That's a mainstream recommendation, but I've had patients tell me that they've taken oral THC and it does help with the neuropathy. So again, it's something worth exploring and trying for yourself. As a quick side note, I always recommend start at the lowest dose of THC possible for people who are not used to it or have tried it before. So chemo brain. So this is the effect on cognition secondary to chemotherapy. It's also known as brain fog. The exact cause is unknown, and typically short-term, but can last longer for some. And symptoms can include difficulty concentrating, focusing, forgetfulness, confusion, inability to think clearly or find the right words, difficulty multitasking, slower to process information. And I think it's important to recognize here that if you look at all these things I just mentioned that's on the slide, all these things can occur if you're having anxiety or stress or you're feeling overwhelmed. So to be sure to focus and look at if those are possibly things that are going on too, aside from just the effect of chemo brain from cancer therapy. So current recommendations. So I would always recommend to discuss with your medical provider just to make sure there isn't an underlying condition that needs to be evaluated or treated. So that's always the first thing, is to discuss with your provider if you're having any of these symptoms of brain fog. Inform your family and friends to support you, staying connected in terms of having people around to help you, staying organized, taking notes, recording things using a calendar, kind of basic things that you would think to do. But just doing those things helps to lessen the frustration of forgetfulness that can occur. So mindful activities. So specifically reducing stress and reducing or calming brain clutter that's going on can just worsen and worsen the symptoms of chemo brain. So just making sure to incorporate mindfulness activities in your daily life as much as possible. Physical activity. So physical activity or exercise increases mental alertness. So it helps you to stay mentally active as well. Ensuring good sleep. If you haven't, everyone knows if you don't sleep well, if you have a terrible night's sleep, you're not thinking or processing well the next day. So the importance of good sleep, which I'll talk more about later also. And in eating a healthy diet, focusing on plant-based foods, getting all the colors of the rainbows to get the phytonutrients and antioxidants in your food, specifically healthy fats and omega-3s that you can find in fish and flax seeds and walnuts are all important for brain health. And really making sure you're getting in good protein intake. And just I've listed a few proteins there. It's not always animal proteins. You can get it through tofu, tempeh, beans, nuts, etc. And really avoiding sugar, as sugar increases inflammation and causes a lot of problems, which I'll talk more about in a moment. Insomnia and fatigue. So causes anxiety, depression, stress, life disruption, pain and medications such as steroids. Steroids make it difficult to fall asleep. So for those who are on daily steroids or weekly steroids, they can have a problem with difficulty sleeping. Polypharmacy, or in other words, being on a lot of different medications their interactions of the medications can have a cascade effect of causing multiple different types of side effects, one of them being fatigue as well as insomnia. And again, poor nutrition can impact that as well. So although fatigue is feeling physically, mentally, and emotionally exhausted, insomnia can be anything of, difficulty falling asleep, staying asleep, or too few hours of sleep. I do want to mention here, though, just as a nurse practitioner provider, if the insomnia or fatigue are new, be sure to see your medical provider, again, to rule out other causes. You could be anemic or have a thyroid issue or nutritional or vitamin deficiencies, which can cause you to be really, really fatigued and not have good quality sleep. So do make sure, if it's a newer thing, to touch base with your provider. So there's a lot on this page, and I'm sorry for that if it's small for those of you looking on a small screen, but I'll go through them here. Good nutrition. Good nutrition reduces fatigue and may improve sleep even. So there was recently a trial that showed lymphoma patients who ate more whole grains, fruits and vegetables, fatty fish, plant-based diet overall reported a decrease in chronic fatigue. So again, showing the importance of nutrition. Avoiding or reducing alcohol, and of course limiting caffeine, and especially avoiding it in the afternoon. Daily physical activity improves sleep, and daily exercises reduces fatigue. There's been a ton of research showing the benefit of regular exercise in reducing cancer-related fatigue, especially for those currently receiving therapy, but even for those after therapy is finished. Deep breathing exercises and meditation, mindfulness activities, and music therapy are all been shown to be helpful in clinical trials in terms of reducing insomnia, improving fatigue. And there was specifically a trial on Tai Chi and insomnia that was really positive effect, showing the benefit of improved sleep for those who did Tai Chi. Stretching for 5 to 10 minutes before bed. This improves blood flow and releases muscle tension. So I recommend everybody to do a gentle stretching before bed. Aim for 8 hours of sleep every night. I know some people can get through 5 or 6, but really you want to try to shoot for the 8 as much as possible and avoid long naps during the day. If you are a napper, I recommend putting a timer on to try to avoid sleeping really more than 30 minutes on the daytime. And the more you sleep in the day, it's going to affect your nighttime sleep. Sleep hygiene. You can Google this online, but really in a nutshell, really having a fixed time, fixed wake up time, have a constant routine. You want to prioritize your sleep. Prioritize your sleep like you prioritize having dinner at the table with your family, or, having your breakfast for you at work, or whatever it is. But it's really important to make sure that sleep is prioritized and not something we just have to cram in for the day. A 30-minute wind down period before bed, and really avoiding electronic devices. I can't emphasize enough the importance of not looking at a phone or a laptop or something before you go to bed. This stimulates your brain activity and you start thinking about a lot of things. And also the bright lights in the phone or the computer drive wakefulness, and it hits a part of our brain that tells us, okay, it's time to be awake because of that bright light, and it actually suppresses melatonin, which our body naturally makes. So it's really important to avoid that bright light, within 30 minutes before bed. There is a setting on phones called the night shift mode. So if you go to your settings, you can hit night shift and pick a time frame between like 8 p.m. and 6 a.m. So if you're someone that has to look at your phone, if you have kids out or something, at least when you look at your phone at 9 o'clock, it's a much softer background light and it's not so bright. Hopefully less stimulation to that part of the brain so it doesn't think it's wake up time. So supplements for insomnia. So everyone knows melatonin. It's something that can be tried. Magnesium is good for our heart and for calming. And the Calm powder specifically is a brand that's often used in the integrative world. If you take a supplement, 250 to 400 milligrams at night, higher doses of magnesium can cause diarrhea. So just be aware to monitor your bowels. THC is helpful. I've had a lot of patients that have taken THC specifically 2 to 5 milligrams, and that helps with their sleep. So that's something that can be explored. And again, always start with the lower doses. Essential oils for sleep. So just smelling lavender and bergamot. There's a lot of clinical trials showing the benefit of lavender essential oils for improved sleep. So whether you put it on your pillow or just smell it before you go to bed or put it on the sides of your temples, that can be helpful. Drink some valerian root or chamomile tea. Those are both herbs that also help promote a good night's sleep. And then in terms of fatigue, so there is American ginseng, also known as Wisconsin ginseng, at 2 grams a day. It can be helpful for chronic fatigue. I do want to make sure, really important to know that if you were to look at something like this, first of all, make sure with any of these supplements I'm mentioning to touch base with your medical provider to make sure there isn't a direct drug interaction or contraindication with any of the medications you're on, because many herbs and supplements, you may need to be careful with taking blood thinners and things of that nature. But also the second thing with American ginseng is that you want to make sure it's not made in ethanol extraction. If it's an ethanol extraction, it can increase the estrogenic effect or have an effect on increasing breast cancer potentially or hormone-driven cancer. So make sure if this is something you're trying and you can safely do it with your other medications, you want to make sure it's water extraction only method. L-carnitine at 2 grams a day. You would titrate up that dose slowly. If you have peripheral neuropathy, you do not want to take L-carnitine because it can actually worsen peripheral neuropathy. And essential oils for fatigue, peppermint and lemon. So you could get a supply of different oils, and you can use the ones for sleep, and then for fatigue, it can be peppermint and lemon. I've shown to be very helpful. I just want to make a quick note that with all these supplements, if you notice, they're at the very bottom of my slides, because I think it's always most important to go through each of these things first. So your nutrition, activity, exercises, mindfulness, those things are of utmost importance. If all those things you're doing regularly and you're still having trouble, then start exploring this supplements. It should really be an additive, not the thing to turn to. And I realized I skipped over cognitive behavioral therapy for insomnia. I know Cedars offers an online course, but that can also be helpful for insomnia too. So depression, anxiety, and distress. I won't go too much, and I think everyone has a general idea of what these things are, but I do want to mention that depression, sometimes can be from a really severely low B12 level, or if your iron studies are low and you're really fatigued or your thyroid level's off. So again, always check with your primary care or your oncologist to get these levels checked to make sure there isn't a deficiency that can be corrected. Anxiety is important to help manage that because it can increase your blood pressure, heart palpitations. It can cause poor digestion and insomnia, difficulty sleeping. Distress is usually kind of more the acute state of life stressors or disruptors in life that create distress. So an acute, unpleasant, or undesirable experience like being diagnosed with cancer or going through cancer therapy, or for even people, PTSD, they're done with, let's say for someone who's done with their therapy or they're on some kind of maintenance. We have a lot of patients that really experience PTSD, post-traumatic stress disorder, and really have a lot of distress because that's like kind of what's now, and they feel nervous going forward. So it's important to kind of look at all those things, and that's why we're looking at them as medical providers. I do also want to mention that there's different medications can have an effect as well. So aromatase inhibitors, anastrozole, exemestane, letrozole, tamoxifen, all these affect your hormones, or Lupron as well. So that can cause, emotional changes if you have these hormone changes. And then steroids, again, kind of wire people up. I've had patients just are through the roof feeling anxious and mad and frustrated from steroids. So important to really look at the medications that you're taking. This might look familiar. It's a distress screen that we hand out, a similar one to this in our clinic. And I just want to make the point here with distress is that, it's not just, are you depressed or are you anxious, but it's really kind of, okay, what are the practical problems, childcare issues, family problems, emotional problems? And it's really important for your medical providers to really bring attention to these and give the appropriate referrals, whether it's a therapist or financial assistance or physical therapy, because we know a lot of these things, if they're not going well and they're problematic in someone's life, are associated with poor health outcomes. So very important form for us and for you to fill out when you come into your doctor's office. All right, so recommendations for these. So antidepressants and anxiety medications, we all know that those are available. They can all be very helpful. But I think what's even more helpful is the following things that I'm going to go through. So therapy with a licensed practitioner, social worker, psychologist, psychiatrist, really important to help get to the root cause of some of these things, or cognitive behavioral therapy can also be very effective. So exercise and activity, including yoga, Tai Chi, and Qigong. So it doesn't have to be just going to the gym or doing a HIIT exercise. Anything, just kind of movement and body flow, mind body type of things, including yoga and Tai Chi, can be very helpful. And keep in mind, exercise increases serotonin. Serotonin improves our mood, our sleep, our digestion. So that's why you've heard people say, if you've not experienced it yourself, when you exercise, you feel better. So capitalize that and remember that and try to keep moving that forward. Acupuncture has been shown to be very helpful. I'll show you a slide on the next page, specifically when the guidelines suggest for acupuncture. Breath work. So there's 4-7-8 breathing from Dr. Andrew Weil, University of Arizona. There's box breathing. You can look these up online or do it with your social worker or therapist who are often trained and know how to do these things. But breath work is really important because it stimulates our vagus nerve and it takes us out of our fight or flight moments and helps us get into a rest and digest state of mind and physical being. So very important for breath work, whether you do it religiously every day or whether you just do it in the heat of the moment when you're feeling the anxiety come on. Essential oils that have been helpful are lavender and bergamot. Social support, so being connected to your church and sports activities and community activities and with your friends and family. And again, we're back to nutrition. So reducing processed foods high in sugar, eat whole foods, focus on foods that support the microbiome. So the microbiome is our natural gut bacteria. And we know that high fiber diet and fermented foods helps support a better microbiome. And 90% of our serotonin in our body comes from our gut. So it stands to reason that the healthier our gut, the better supply of serotonin, again, helping with our mood states and helping with depression and anxiety. Supplements that can be considered, so low evidence, but worth trying. And again, with all these supplements, this is really about shared decision-making with your provider. And I know a lot of medical providers might just say no to every supplement, but I think it's worth looking at these supplements and having that discussion with one of your providers and just making sure that there's no contraindications to medication you're taking. But if there's no harm to it, then I think it's worth trying these things. So ashwagandha can be something that's very helpful and became actually quite popular during COVID when people were looking for supplements helping with anxiety of being home. You do want to caution use if you're on thyroid medication. L-theanine or 200 milligrams has been helpful. I've had a couple patients that have tried that and has helped their mood, and chamomile as well. And then again, looking at vitamins, if there's any deficiency in vitamin D or B12 or folate, correcting those can also often be helpful in terms of relieving some of these symptoms. So this was an ASCO and guideline along with Society of Integrative Oncology, and they recently came out with this. So if you look at the box on the left, anxiety treatments during treatment and post-treatment are the recommendations from the evidence and the clinical trials that were reviewed. And then on the right, you have depression. And on, again, the left is if you're in active treatment, and the right, post-treatment. So if we're looking at post-treatment for the purposes of today's conversation, if you're having anxiety, mindful-based interventions, yoga, acupuncture, Tai Chi, all of those have been helpful. And then similarly with post-treatment as well. So really looking at those for those kinds of providers and lectures, which I'll have resources on the last page. Sexual function. So that can be anything from low libido, erectile dysfunction, difficulty orgasming, sex organ numbness, pain with intercourse, vaginal dryness, fertility issues, body changes, self-image, roles, relationships. So it's the whole gamut of anything sensual or sexual with yourself or with your partner. The causes can be medication. So again, we're back to the hormone suppressive therapies, tamoxifen, the anastrozole, letrozole, exemestane, the Luprons. These stop hormones from being made or attaching to cell receptors, and this has an effect on our sexual organs. Chemotherapy causing menopause. So for someone who is, a woman who's, is having periods and they're suddenly thrown into menopause with chemotherapy and they develop vaginal dryness, or just all the side effects that come with menopause. Surgery, so hysterectomy, prostatectomy, or a mastectomy. So again, it's not just, losing your prostate or, losing your cervix, but even losing your breast. The breast is a large sexual organ for women in terms of touch and feel and sensitivity. So that also can be impactful. Radiation to the breast or pelvic region, and all these things can decrease blood flow and sensation and dryness. So for vaginal dryness, non-hormonal local moisturizers, there's a few out there, Creme de la Femme, Replens. Those are ones we've been recommending or suggesting our patients for years. Reverie is a newer one, which is a tablet that's inserted that can be helpful for vaginal dryness. And these are all non-hormone. And then lubricants. So that's like Uberlube, Platinum, any of those brands. And the difference is the moisturizer is really kind of helping more kind of daily discomfort with walking or sitting for vaginal dryness. Lubricants is more for in the moment of sexual intercourse or intimacy with your partner. And then there's vaginal estrogen cream. So for years, we've always, wanted to avoid this in our breast cancer patients. But recently in the American College of Obstetrician and Gynecology, they are saying that it is safe now or they believe it to be safe for breast cancer patients to use vaginal estrogen cream. So this is now okay and part of the guidelines recommendation to treat atrophic vaginitis or vaginal dryness. So this is something to talk to your gynecologist, your oncologist for this prescription. And this is safe and can be used now for vaginal dryness. Physical therapy. So there are physical therapy offices that do pelvic floor physical therapy. So look to your local in your local community for those offices. And then mental health. So a lot of times, there's a lot of resources from the cancer support community. I know they have a couple of classes or video lectures that I believe you can access if you contact their office, but really great lectures on menopause and dealing with menopausal symptoms and sexual changes as well. And a lot of that can be, aside from using these ointments but it's also maybe reframing what sex is in your relationship. It's not just intercourse. It can also be foreplay, touch, and alternative ways to stimulate sex organs. So kind of thinking outside of just intercourse, it's a lot of times it's working on other possibilities. And of course, there's erectile dysfunction for men, for Viagra, Cialis, and then acupuncture for fertility issues. So acupuncture can be very helpful for the younger women who are trying to conceive after cancer therapy. That might be something to add to your fertility appointments. All right, cardiac health. So Cancer therapies can cause hypertension, coronary artery disease, congestive heart failure, cardiomyopathy. And these, you can read through these drugs here, but there's a slew of them, different chemotherapies, targeted therapies, immunotherapies, all that can have an effect on your heart in one way or another. It's important to note that not all therapies are cardiotoxic, but there's definitely, these are a good chunk of them listed here. So if you're not sure, you can always check with your oncologist about what you received to see if any of them were cardiotoxic or have an effect on your heart. So you need to look at risk factors. So a lot of non-modifiable, so things that you cannot change, is the type of cancer therapy you're given. So if there's a clinical guideline to receive this certain kind of therapy for cancer, you need to receive that. And so that's not something you can change. If you've had a history of radiation to your chest wall, like if in a situation of childhood lymphoma, that can have an effect that you can't change. And then just being over the age of 65. Modifiable or changeable risk factors are obesity, diabetes type 2, blood pressure, your lipids, smoking, diet, exercise, mental health, all of these things we have control over. So that's where we really go in terms of cardiac health and the recommendations. So before I mention that, cardio-oncology is an emerging field. So this is a cardiologist that has specialized training in oncology. We have one here at Torrance, Dr. Brenton Bauer. He did a lecture previously for this South-Based Survivorship Consortium. So you can go back on the website and find his lecture. It's a great lecture on talking about cardio-oncology. But he actually does consultation for cancer survivorship, primary prevention. So whether you make an appointment with him or look for a cardio-oncology doctor at your cancer center, I think that's a good thing to do. And then diagnostic imaging is listed there as things that should be done before you see a cardiologist or that the cardiologist might order. They might cardiologists might then put you on medication, cardioprotective medication. Weight loss and maintenance is always recommended. We all know that obesity increases heart disease, so an important part of cardiac health as well, in addition to cancer. Healthy diet, Mediterranean diet, anti-inflammatory diet, and exercise. So cardiac output. So you want to increase your cardiac output and increase circulation. So that's why exercise is important. Remember, our heart is a muscle as well, and we need to be using that muscle to keep it working well. And then mind-body activities, mindfulness activities help reduce stress and anxiety and can help reduce your blood pressure and heart palpitations. All right, so osteoporosis, causes, chemotherapy, whether it's directly or indirectly by ovarian suppression, can cause osteoporosis because, again, it's lowering the hormone levels. And then aromatase inhibitors for breast cancer patients are a big issue for causing osteoporosis. Other risk factors: age, genetics, gender, body frame, menopause, hyperthyroid, hyperparathyroid issues. If you have multiple myeloma, celiac disease, rheumatoid arthritis, long-term use of some medications like steroids or reflex medications like the proton pump inhibitors, tobacco use, smoking, lack of exercise, poor nutrition, high sugar, salt intake, malnutrition, excessive alcohol. So all of these things can affect osteoporosis and are important to pay attention to. I do also want to mention that stress actually can have an effect. Now, it's certainly not going to be as big of an effect of a lot of these other things mentioned here, but there are several potential molecular links between the pathological response to stress and the development of bone loss or bone disease. So remember, stress equals cortisol levels, which then leads to systemic inflammation, which starts that whole cascade effect of a lot of these chronic illnesses or issues. So we recommend a bone density every 2 years. We look at the T-score, which is a numeric value to help us know if it's normal osteopenia or osteoporosis. Supplementation with vitamin D is really important. So there's a lot, and the research on calcium supplements is somewhat mixed. It's not really a strong recommendation to take calcium for prevention and management for osteoporosis, but the data is mixed. So you can still go to different doctors and they'll say different things. But that's, at least in our clinic and from my purposes, from what I've read, I'm not a proponent of taking calcium supplements. I really focus on the vitamin D, and we look at a goal between 40 and 60. There's oral medications listed there. If you have severe osteoporosis, we would refer you to endocrinology. Weight-bearing exercises. So this is really, really, really important. So of course, we all know weight-bearing exercises like lifting weights, jogging, walking, aerobics, stair climbing is all important for our bone health. But really, truly, it's the high intensity and high impact exercises that give the most benefit. These standard weight-bearing exercises of walking every day are really not adequate to impact bone density. So that's huge, because forever we just say, just walk, that's good enough. But really we're finding that that's not enough. And high intensity, high impact exercises, can be dangerous for some people depending on what your history is and your medical condition or your age. So we do recommend working with a strength training or an exercise therapist trainer for safety. And nutrition, so calcium-rich foods. So don't take a supplement, but make sure you're getting calcium-rich foods and magnesium-rich foods, which I've listed a bunch there, and you can Google as well. Just trying to get those in your diet every single day. And then again, because we know the relationship between stress and inflammation, leading potentially to osteoporosis, mind-body exercises are important to do. So gastrointestinal changes, so constipation or diarrhea. So surgery can cause, abdominal scar, let's say, causes adhesions, and that's going to affect and put pressure on your colon and can cause diarrhea or constipation. Mechanical changes in a head and neck cancer patient, for example. So if half your jaw has been removed or muscles have been removed and you can't chew as well or swallow as easily, that's going to be affecting how you can eat and then the end result of what your bowel movements are. Immunotherapy can cause colitis or diarrhea. Targeted therapy, pain medications can cause constipation. So all these things can have an impact on your bowels. But as always, if the changes are new, you're newly having diarrhea, cramping, constipation, always touch base with your provider to be worked up first. To make sure nothing else underlying is going on. Diarrhea may cause the inability to absorb needed nutrients and cause and risk for dehydration. So that's why it's important to make sure you're drinking a good amount of fluids, and particularly with electrolytes. And then constipation, as we all know, can worsen hemorrhoids, anal fissures, diverticulosis, lower transit time. Lower fiber intake is associated with a leaky gut. So leaky gut is a theoretical concept about our intestinal permeability. And it's increased with a leaky gut, meaning that more larger toxic molecules or bacteria can leak out of the gut and into the body, again, causing inflammation and that cascade of inflammation. So important to have fiber. So fiber is key. So I've listed some things here. This is nothing really kind of, is nothing that probably nobody already knows, but really kind of lifestyle changes for diarrhea. So avoiding caffeine or very hot or spicy drinks can make things worse. Constipation, making sure you're increasing your hydration, teas, fiber, and having more of a plant-based diet. And just as a side note, we know that, a plant-based diet and a diet high in or nuts, as long as you don't have diverticulosis, is helpful in terms of reducing colon cancer. And then for both things, exercise, being active, walking, yoga, stretching. So even laying on the floor and twisting your body and your hips and your legs side to side just helps your muscles on your abdomen move and put pressure on your colon, and can be helpful for those who have constipation, or just kind of a gentle massage of your abdomen as well. So movement is key here. Acupuncture can actually be helpful as well for both of these things. And again, the microbiome, as I mentioned earlier, for better gut health. Eating, fiber and probiotics or taking probiotics is fine if you don't want to work on eating just the fermented foods. All right. I'm trying to speed this up because I know we're getting low on time. So joint pain. So this a lot of times is from the aromatase inhibitors, less common from other hormonal therapies like tamoxifen, Evista, and Lupron. But these are all the recommendations here. The number one recommendation is acupuncture for joint pain. So that beats out all prescription medication. So acupuncture is the most recommended thing for the joint pains from the aromatase inhibitors. Keeping your inflammation low in your diet with an anti-inflammatory diet. Supplements I've listed there: glucosamine chondroitin, curcumin 1,000 milligrams a day, CBD 25 to 50 milligram a day is an anti-inflammatory, can be helpful for some, and fish oil 2,000 milligrams a day. And not taking all those things, but these are the things to explore and potentially try if you're having joint pains. And again, movement, exercise is really important. This is another schema put out also by SIO and ASCO in terms of guideline recommendations. And you can find this online, but this just, again, goes through the data, the things that are shown to be effective for different types of pain: cancer pain, joint pain, peripheral neuropathy. So you can see here, acupuncture is one of the top ones in most of these groups, along with yoga. All right, weight changes. So this can happen because of menopause, poor diet, secondary to taste changes or eating habits, alcohol, smoking, depression, lack of exercise can cause weight gain. And it's really hard. It's an uphill battle, I know, for a lot of people to lose weight, and especially when you're on these medications that make it more difficult. But it's a really big focus in the cancer world and for the oncologists in our office, because obesity causes inflammation, which we know is linked to cellular mutation proliferation. It's basically creates a microenvironment that's conducive to cancer. So that's really a top thing in terms of cancer survivorship to help to lower weight as much as possible and for weight management. So recommendations. So I've listed a bunch here. Again, nothing earth-shattering, but working with a dietitian, exercise therapist, joining a gym. Do what's best for you. There's online videos that are free on different kind of yoga and exercise classes. There's a bunch of free classes at your cancer support community, online or in person. Get a Fitbit if you're more kind of person that looks at numbers and you like to follow that. That might be better for you or if you're more social than meeting up with a group of people walking every day. But find what works best for you. I've got some resources at the end that do mention, for example, this AICR 10-week challenge. It's free. You go online and it's a 10-week challenge on nutrition and exercise. And of course, there's different local weight loss classes at our hospital, and check with your institution as well. I want to mention here, fasting is important. Now, this would not necessarily be for a diabetic patient, or at least talk with your doctor about this, but eating between an 8 to 10 hour window has been shown to be helpful in terms of helping to manage weight and reduce and lower the risk of gaining weight. And we know that fasting decreases glucose levels in the blood. It decreases the production of inflammatory cytokines. It decreases growth factors, decreases DNA damage. So it overall decreases chronic disease and cancer. So fasting can be really helpful. I would say 14 hours is kind of the recommendation, but I would say at least shoot for 13. There was a study on breast cancer patients that showed that those who fasted for 13 hours every night overall had a lower recurrence of their breast cancer. So we know that at least with 13, you're getting that a benefit there. But again, if you have issues with hypoglycemia, you want to make sure you're touching base with your oncologist. So lymphedema is fluid that builds up below the skin. It's can caused by surgical removal of lymph nodes or by radiation. It can occur years after therapy. Really, the risk factors are not so much as getting a blood draw, which is what we thought for a year, or flying on a plane, but these are the three things that consistently come up in the data: is being obese or overweight, you have a higher risk of lymphedema, lack of upper body movement and exercise. So it's really about improving and doing upper body exercise and weightlifting. You don't want to not use your arm at all. That's shown to be worse. So exercise improves collateral circulation and reduces inflammation, and avoiding infection. So good skincare and avoiding the risk of infection coming on. So again, avoiding the IV and blood draw and blood pressure is controversial. That's not something that is really a strong recommendation. I generally tell people, if you can avoid it, you got a good vein and another arm to use, go for it. But ultimately, it's not really increasing your risk of lymphedema. And there's a lot of different lymphedema certified therapists in different hospitals. So make sure you work with them if you're having that issue. Hot flashes. So endocrine therapy, again, causes hot flashes, stopping hormone replacement therapy, or abrupt onset from chemical or surgical menopause for women. And again, other risk factors that increase hot flashes: obesity, alcohol, certain foods, smoking, anxiety, and poor sleep. So in terms of recommendations, so kind of, stuff you'd already know: avoid spicy foods, alcohol can make hot flashes worse. Wear breathable clothing, stress reduction activities, and breathing techniques. Acupuncture, again, has the best evidence over, a head-to-head trial between acupuncture and I think it was venlafaxine a few years ago, showed that acupuncture was superior for treating hot flashes. So that's one thing to really consider if you're having hot flashes. Prescription medications like Prozac, Effexor, or Trazodone are always available. And then the natural supplements. And I just want to mention, Relazin from Sweden and Remifemin from Germany, which is actually just black cohosh. Those things can be helpful for hot flashes. It's not a strong recommendation. There isn't strong data to support it, but it can be helpful for some people. It might be something to consider. But with black cohosh, we do recommend avoiding it if you're on tamoxifen. All right. So quickly, vision. I'm just mentioning it here because I think vision is one of those things where it's not a clear your chemotherapy or your cancer therapy is going to cause vision changes, but we do see some changes later on, maybe increased risk of cataracts and problems that can be caused from steroids. So make sure you keep up with your eye appointments and make sure they know your history, your doctor of having chemotherapy. So dental, this is also chemotherapy can affect tooth enamel. People who are on Zometa have a risk of osteonecrosis of the jaw, in which case you need to see a specialist endodontist. Radiation of the head and neck can cause dry mouth, gum disease. Acupuncture, again, actually is helpful for xerostomia, or dry mouth is what xerostomia is. So just make sure good oral care and regular checkups with your dentist is really important. And just a quick mention here on immunotherapy, and I'll hopefully be wrapping up so we have a few questions at the end for those who have any questions. But immunotherapy is, more, we're seeing that much more, especially in the survivorship world. So, it's tricky because there are long-term immune-related side effects. So it can affect endocrinology, so cause thyroiditis or hypothyroidism, adrenal insufficiency. And many times when these things come up, they are long-term and they require long-term prescriptions of Synthroid or steroids and require endocrinology follow-up. Arthritis and joint pain. So this can be really severe and debilitating for people and require long-term use of steroids or anti-rheumatic drugs like methotrexate or other medications like monoclonal antibodies. So these are things that we're going to be seeing more and more of and really require treatment from specialists because of the significance that they can have. Skin irritation from immunotherapy, rash or mouth sores is quite rare long-term, as well as gastrointestinal like ongoing colitis, but is possibly something we can see. Okay, a couple of minutes to go through this really quick. I promise I'll be done. So I just want to mention the importance of kind of integrated oncology and wellness after cancer therapy. And the data really, data shows that regular exercise and diet modification leads to a better immune function and lower insulin levels, which are associated with cell proliferation and mutation. So again, the importance of exercise and diet modification. Lifestyle modifications reduce cancer recurrence, cancer progression, and have a positive effect on health. So not just for those done with treatment, for those who are actually in active therapy, it can really help slow cancer progression. Is also important to do throughout the entire trajectory of your cancer therapy. So integrative oncology, this is just mostly about exercise, the importance of 150 to 300 minutes per week, or 75 minutes if it's rigorous. So this would be a slide I would take a picture of, and the next one as well in terms of what to do. So this should include weightlifting and weight strengthening aerobics. Resistance training and muscle strengthening, we know lowers chronic low-grade inflammation and, again, insulin resistance, as I mentioned earlier. So really important to get that resistance training and muscle strengthening in addition to aerobic exercise. So it restores and improves physical function, it improves cardiopulmonary, endocrine, neurological, muscular, cognitive, and psychological function, improves body image and quality of life, improves treatment tolerance. There's studies that show that they actually a group that did exercise while on chemotherapy, they actually had a shrinking tumor more than the group that didn't do the rigorous exercise. So really important effect of exercise on our body in terms of cancer prevention and shrinking cancer. It reduces the risk of recurrence and development of cancer, 55% reduction in breast cancer recurrence, and 25% reduction in all-cause mortality for all cancer survivors. So again, just pointing out the importance of that. It mitigates long-term and light effects of cancer therapy, which I've hopefully shown you tonight through this talk. And really, just in general, avoid inactivity. Movement is key. I just recently heard a talk where the doctor said, sitting is the new smoking. All right. And lastly do I have one more minute? I'll be done, Brittany. All right, so maintaining a healthy weight, intermittent fasting, if that's safe for you and you can do, avoid eating 3 hours before bed, eat a diet rich in whole grains, vegetables, fruits, nuts, and beans. The Mediterranean diet is the most recommended diet or the best one for cancer, health, and prevention. ASCO 2023 showed it reduced the risk of all-cause and cancer mortality significantly. Look at food as medicine. So rather than taking an omega-3 and an antioxidant and anti-inflammatory, For omega-3s, eat salmon, walnuts, and flax seeds. For your immune health, eat cooked mixed mushrooms, citrus, garlic. Antioxidants, eat broccoli or broccoli sprouts, which are even higher benefit than regular broccoli. Berries, dates, and cocoa or dark chocolate. For your anti-inflammatory, have olive oil every day, nuts, turmeric, green tea. Adding all those things into your daily regimen, your diet is really helpful in terms of overall health. Eating all the colors of the rainbow to obtain micro and phytonutrients. If you look up AICR, foods that fight cancer, it will show you this whole beautiful page of all the specific foods that are known to be associated with reducing or fighting cancer. So check that out online. And then again, focusing on fiber and fermented foods. Lower sweetened drinks, reduce packaged foods, reduce sugar, high sugar starches, avoid processed meat. They're considered class 1 carcinogens. So I'm sorry for people who love bacon, but that is something that should be avoided, is considered a class 1 carcinogen causing cancer. And reduce meat. Don't eat more than 12 to 8 ounces per week. You want to limit or reduce your alcohol. If you do drink alcohol, try to avoid drinking it on a nightly occasion. Give your body a break from that. And lastly, there are no supplements that prevent cancer. So it's all these things we talked about, but no specific supplements. But we do know that vitamin D is helpful in terms of, or associated with, lower recurrence of cancer. So I just want to end with this slide here from Donald Abrams. He's an integrative oncologist at UCSF. This is adapted from talks that he's given, but cancer is like a weed in a garden. Integrative medicine helps make your soil as inhospitable as possible. So all of these things we've talked about are so important. These are the resources here. And I don't know if anyone wants to take a screenshot or take a picture of that, or maybe we can put this on a PDF and attach it to the talk that'll be uploaded in a couple of weeks. But you can see through here a lot of these things I talked about, I mentioned. So on the left side, AICR Healthy 10 Challenge, or the Activate 8-week healthy lifestyle program that's in the UK, but we can join it here. A lot of different healthy recipes, different online free exercise, lifestyle, fitness type classes. So please take a picture of this or look at this, or we'll try to find a way to post it upline. But a lot of really great resources here for mindfulness and breath work, as you can see here. So thank you so much. And I know there's only a couple of minutes left, but if anyone has a pressing question, and I'm sure we can try to find a way, if anyone wants to email me questions later on, I'm happy to do that as well.
Thank you so much, Susan. You are such a wealth of information and knowledge, and this has been a really excellent overview of all of the different things here. So thank you so much, Susan. We are so appreciative of everything you've shared.
Thanks so much for having me. I really enjoyed it. Hope it was helpful. Thank you.